In 1918, the Statistical Manual for the Use of Institutions for the Insane was created, and in it, the definition of mental illness was that it only came from physical issues the patient dealt with. But after World War II, millions of soldiers and families dealt with shell shock and PTSD and other forms of mental disorders. The American Psychiatric Association realized that physical trauma was not the only cause for mental illnesses.
Thorazine was an antipsychotic that was originally noticed to have calming effects on patients before procedures. It used to be used as a mild sedation, used in replacement for full anesthesia, but one of the side effects that this caused in long-term individuals was that they would appear to have Parkinson's disease.
Thorazine originated in France in 1952 and was used on the French army as an anesthetic. Later, it became global and popularized in countries like Switzerland, England, and the U.S. This led to a deinstitutionalized movement in the U.S.
Imipramine, a drug that was used for allergies, became a hit for antidepressant medication in the 1950s. Founded by Swiss psychiatrist Roland Kuhn, it became a commonly used drug for those with schizophrenia, depression, and other mental disorders.
Gee, I'm really down. I hope this medicine my doctor prescribed will work. Oh my gosh, it worked!
In 1945, the transorbital lobotomy was commonly used in hopes of treating those suffering from anxiety and depression. This procedure was commonly used in Europe and in North America. A probe would be inserted into the frontal lobe through the eye socket in hopes of fixing the disorder. There was another way to also perform a lobotomy, and that was to pour rubbing alcohol into the frontal lobe to disrupt neural tracts.
After World War II, many electroshock therapies came out. There was one, which was electroshock therapy, using electrical currents to jolt the body, causing severe memory loss or permanent memory problems. The second one was insulin therapy, and that was used by injecting lots of insulin into the body at one time over the period of many months, and it would cause a coma throughout the body.
Imipramine, Thorazine, electroshock therapies, and lobotomies. Not all of these were good ideas, and some caused more harm than good, but all of these innovations contributed to the overall advancements of mental health around the world. The U.S. has changed a lot in terms of how mental health is perceived, especially in the mid-20th century to today. Mental health healthcare, like medication and therapy, have become more accessible to people around the world through globalization by destigmatizing negative views on mental health and providing inclusivity for those who need it.